My name is Jen Camposano. I am an interesting breast cancer story. I think every story is unique, but so I was diagnosed in 2011, and my son was 5 months old, and I was told for 4.5 years that it was metastatic, and treated for metastatic disease. And then last spring, they determined through a lung biopsy that it was actually an autoimmune disease along with early stage breast cancer. So I feel like I'm straddling this weird world between the Mets community and figuring out what it means to call myself a survivor, who is now 5.5 years out from diagnosis. I am here with YSC as part of their new class of RISE advocates. So we will be diving into, as part of that program, diving into some more of the science behind breast cancer, and in order to empower and advocate for other young women. I feel like I've got to do something with this experience, right? And so I'm volunteering with YSC on that behalf, and you can visit their website and learn more about the program or any of their programs at youngsurvival.org. This session is also being recorded and will be your Facebook living it, so it's available there, and I believe it will also be accessible on the YSC website in a few weeks. I want to introduce our speakers today. We've got Dr. Rachna Patel, has been practicing in the area of medical marijuana since 2012. She step-by-step walks patients through how to use medical marijuana for their specific medical condition without getting high off of it, without getting addicted to it, and without smoking it. She speaks from the experience of having treated thousands of patients and having read research study upon research study on medical marijuana. She completed her medical studies at Touro University College of Osteopathic Medicine and her undergraduate studies at Northwestern University. You can learn more about the work she does at www.drrachnapatel.com. And then our second speaker, I'll go ahead and introduce as well. I do have to cut out early to catch a flight, so just in case I'm not around for the entirety of the session. The second speaker will be Stori Nagel. She is the YSC state leader for Riverside County, California, and founder of Haus of Volta, a collective aimed at emphasizing positive body image and a healthy lifestyle post-diagnosis. Diagnosed in 2012 with stage 3A breast cancer, she had chemotherapy, double mastectomy, reconstruction, and a hysterectomy. Due to side effects of traditional treatment, she took control of her health by researching alternatives to pharmaceutical management. Extreme anxiety and mood swings became manageable with regular exercise and cannabis edibles. Hormones and menopausal symptoms were regulated with herbal supplements. An advocate for equality among survivors, regardless of reconstruction, ethnicity, or sexual preference, her mission is to encourage not just survivors, but all of us about the importance of concrete knowledge coupled with the confidence to put them into action.
Okay, so I want to thank everyone for taking the time to come and hear this talk. And I'm actually just going to get started and dive right into it. So the topic is medical marijuana for cancer pain. So I want to give you a little bit of a roadmap as to what we're going to talk about. We're going to start with causes of pain in cancer. A lot of it you may already be familiar with. Just sort of want to lay out the basics from a physician's perspective. Then I want to go into the results that I've seen in the patients that I've treated with medical marijuana. And then we'll go into, this is actually my favorite part, why does medical marijuana reduce pain? So we'll go into a little bit of the science behind what's going on in the body. So, causes of cancer, causes of pain in cancer. Really, there are three main causes of pain. One is the cancer itself, second is the cancer treatment, and third is a complication of the cancer. Now, what I want to emphasize here is that there's really two types of pain. There's acute and there's chronic. And what I want to focus on is chronic pain, because what I found clinically is that marijuana does a better job of treating chronic pain than it does treating acute pain. So when it comes to causes of chronic pain in cancer patients, there's a couple different causes. One is that you have the cancer in a solid organ, and what it does is that it's causing damage to the organ. So an example would be bone, right? So if you have cancer invading bone and causing damage, you're going to get bone pain. Second is if the cancer invades a hollow organ, it's going to cause an obstruction, and that can lead to pain. So an example of this is that if you have a tumor invading your intestines, for instance, it can cause abdominal pain. Third is that the tumor is compressing a nerve, and that's going to cause pain. Now, another cause of nerve-related pain in cancer is that the chemo treatment can cause damage to the nerves, and that leads to neuropathy. So in my practice, I've treated basically all of the above that I've discussed. And there are three main areas that I've seen the marijuana help when it comes to pain. One is that it reduces levels of pain, okay? So I want to put this into perspective because a lot of people think marijuana is sort of a miracle cure, and it's not. A lot of pain reduction is really relative to where you start. So patients who start with severe pain, where the marijuana helps is that it makes the pain mild. Now, if you start with mild levels of pain, then it's certainly possible to eliminate the pain. Okay, the other area that the medical marijuana helps with is in reducing the use of prescription medications. And there are three sort of results that I've seen. One is that patients are able to completely come off of their prescription medications for pain and just use medical marijuana. And typically, you don't have to use marijuana on an everyday basis. You can use it as needed, and at most I've found patients need to use it 3 days a week max. And I can go into the science of that in a second. The other result that I've seen is that patients do need to continue to stay on their prescription pain medications, but they're able to reduce the dosages of these medications or the number of medications that they're on. Third thing is that patients still need to stay on their prescription pain medications, but by adding medical marijuana to the arsenal, it does a better job of reducing their overall pain. Okay, third area, and this is where I feel like as a physician, my work is valuable, because when you reduce someone's pain, it has a significant impact on the quality of their life. Pain is just not physical. It seeps into every aspect of your life, emotional, mental. So a lot of times I have patients coming in and telling me that, they're no longer, because of the pain, they're no longer able to engage in the activities that they enjoy. It affects the quality of their sleep. It affects their performance at work. If you deal with pain long enough, you start to get anxiety from it and even depression. So by using the medical marijuana to help reduce the pain, I've seen an improvement in quality of life. So patients are able to garden again, to golf again, even little things that a lot of us may take for granted, like opening jars. There are patients that have said that they're able to carry their grandchildren again. When it comes to quality of sleep, so with the use of medical marijuana, patients have reported that it helps them to fall asleep, to stay asleep. If they happen to wake up in the middle of the night, they're able to fall back asleep easily. And the advantage of using medical marijuana over prescription and over-the-counter medications is that you're not left with that grogginess that the over-the-counter and prescription medications tend to cause. You wake up feeling like you got a good night of sleep. When it comes to performance at work, patients report that because they're able to get their mind off of the pain, it helps them to focus better, to concentrate better, and that then impacts their productivity. With anxiety, one is that the marijuana helps to reduce pain, and then that then helps to reduce the anxiety. But the marijuana itself helps with anxiety as well. So again, patients report to me that it helps to reduce racing thoughts when they get into bed at night, helps to reduce any panic attacks that they have, and overall helps to improve their mood. Okay, so this is, now, like I said, my favorite part, going into the science as to why medical marijuana is reducing pain. So one of the things that it does is that it modulates pain along the pain pathways. And I've probably lost you already. So I'm going to make it simple. Think of the nervous system as an army. And there's 3 components to it. There are detecting troops. There's the command center, which is the brain. And then there are troops that carry out these commands. So let's take the example of detecting temperature. So say your hand is next to something really, really hot. These detecting troops are going to send signals to the brain, warning signals, basically saying that, hey, this part of the body is next to something really, really hot. So the brain is then going to decide that it wants to move that part of the body away from the source of heat. So it's going to send off signals to the troops that know how to move the hand away from the source of heat. So where does marijuana play a role in all of this? So research has shown that in animals that are in states of pain, there are a greater number of cannabinoid receptors along these pain pathways. And cannabinoid receptors are basically a component of the cell that interacts with the chemicals in marijuana. So basically, what these receptors are doing is that they're weakening the signals that are being sent off to the brain. So you have fewer signals, you have weaker signals being sent off from the troops that detect pain. So that's way number 1. Now, second way that marijuana reduces pain is that it alters the perception of pain. So when you feel pain, there's 2 things that are going on. One is a logistical aspect of managing pain. Your brain is thinking, okay, what hurts? How much does it hurt? How much damage is there, etc. The second part of the second component of this is that the brain also emotionally processes the pain. So it's telling you, hey, this doesn't feel good. In fact, it feels really, really bad. So in patients that I've treated with medical marijuana, a lot of times they'll tell me, you know, when I use the marijuana, the pain doesn't bother me as much, or it gets my mind off the pain. And it's really interesting that they say this because there was a study done back in 2012 at the University of Oxford. And what they did was they took 12 healthy volunteers and they applied capsaicin to their legs. Now, if anybody knows, capsaicin is a compound derived from chili peppers. So you can imagine if you apply this to your skin, it's going to burn, it causes pain. Then what they did was they gave these patients marijuana and they took scans of their brain. They put them in an MRI. And what they found was that the marijuana impacts activity in 2 parts of the brain. One is the amygdala, and the second is the anterior mid-cingulate cortex. These are both parts of the brain that are involved in emotionally processing pain. So somehow marijuana is telling your brain essentially, you know what, this doesn't feel as bad. Now, third thing that marijuana does. Marijuana reduces inflammation. So I have a question for you. Has anybody seen the movie Project X? Nobody? Okay. Oh, you have. Okay. So for those of you who haven't, which is most of the room, it's basically the basic premise of the movie is that you have these 2 high schoolers. They're on a quest to get popular, so they throw a house party. And the scene the day after is that the entire neighborhood has burned down. This is basically inflammation. It's doing this much damage to the body. So what marijuana does is that, imagine marijuana as a cop, And before the chaos ensues at this party, marijuana calls in its backup, which are the T regulatory cells. These are cells that we have in our body to make sure that the body doesn't attack itself, cause an autoimmune attack. Second thing that marijuana does is that it goes after the high schoolers that are causing a ruckus, okay? So these would be the immune cells in the body. These are the cells that are sort of propagating inflammation in the body. And then the third thing that the marijuana does is that it confiscates these high schoolers' cell phones. So this would be like cytokines, okay? Cytokines are signals that immune cells send out to start and stop inflammation. So that's sort of a general overall as to common causes of pain when it comes to cancer, results that I've seen, and why marijuana reduces pain. So who the heck am I? Who is this tiny little brown person in front of the stage talking about weed? So I'm Dr. Patel. I have actually been practicing in the area of medical marijuana for half a decade now. I've treated a lot of patients, and the reason that I'm in this field is that my background's in emergency medicine, and as I was going through training, what I saw, there was a couple of cases that sat really heavy with me. One was that I was treating a lot of overdoses on prescription pain medications, especially opioids. Second was that there were a lot of addicts coming in, trying to finagle their way into getting a prescription for these medications that they were addicted to. And then third was that I did a rotation, and it was my toxicology rotation, and the sole purpose of this rotation was to treat overdoses on prescription and over-the-counter medications. So when you take a step back as a doctor, it's like, what the heck am I doing? The very medications that I'm prescribing, I'm then having to treat the overdoses for. This isn't making really any sense. Now, at the same time, I happened to be browsing Craigslist one night. Just couldn't sleep. I came across an ad that said medical marijuana doctor needed. So it definitely piqued my curiosity. And what I started doing was I looked into what the field was all about, because I didn't even know it had existed at that point. And I started looking into the research. And what I found was, I was compelled by the research, definitely. So a year later, what I did was I started working at a medical marijuana clinic, a very shady medical marijuana clinic out in Sacramento. The basic purpose was that it was a mill where you just handed out cards. But what I found was that there was a need for patients to really know how to use this so that they're not getting side effects. They had concerns about getting addicted to it. Overall, they just wanted to use it safely as a medicine. And so that's when I decided to start my own practice and focus on this, to teach patients how to safely use medical marijuana. So if you want to get a transcript of this presentation, you can just head on over to our website, and it's all there.
Thank you.
Okay? And I'll give the stage now to the next speaker. Thank you.
Yeah.
Oh, no, I'm not.
Excited much?
Nah.
Are we going to have time to ask questions?
Yes.
Okay.
After the clock goes off, you pay us $5 per question.
Make it 10 for that one.
Right. So I got into medical marijuana. Well, let me give you a little background first. So my mom had a stroke when I was 7 and was always sick. And I was always very scared that I was going to get sick because they said this is hereditary, you could get it. So I became like a control freak, and I already knew I had mental problems. So like I drew stuff that was out of this world. I loved, Lewis Carroll and things like that. And I was a cutter, and so I already kind of knew I probably shouldn't make it any worse. And my parents never told me not to smoke pot. And I knew that my dad did, even though he didn't do it in front of me. But, and then it turns out I'm allergic to alcohol too. So, I can't do any of that stuff. So, my only association with marijuana was that people that smoke marijuana, they're all on welfare. Nobody fends for themselves. They're all a bunch of losers, and you know. So I didn't have a good association with it. When I smelled it, I'd be like, you know, bad association with it because I didn't understand how it actually helps you. About a year and a half after most of my treatments were done, I started to come unglued. I was having outbursts, kind of like a Tourette's kind of a thing, where we'd be watching TV and some girl with great big boobs would be on the TV, and I'd turn to my husband and be like, I know you were staring at those pictures! And I go, sorry. Like, have outbursts. I was yelling at my kids, like all this stuff that we have to process. The lid came off and I wasn't able to keep it under anymore. And I went to my doctor and said, I'm coming unglued. These things are happening. And he goes, yeah, that's really strange because when I told you you had breast cancer, you just went, okay. So he prescribed me Zoloft. And no, I don't have anything against anybody that's on Zoloft. It just didn't happen to work for me. Took about 2 weeks to work. I didn't feel like I was coming unglued anymore, but I could not stay awake. And I went in there because I have arthritis in my foot and in my back, and I was looking for a confirmation. And he goes, oh, BT dubs, that stuff you're on is really addictive. I freaked because I have addicts in my family, and I didn't want to become addicted to anything. I mean, I'm already like a self-professed sugar addict. I don't need to be addicted to anything that's really gonna make problems. So, quit cold turkey, was on somewhat of an organic mood enhancement, and my dad goes, here, have one of these cookies. Never had anything ever like that in my entire life, but I was fried, and I knew I was fried, and I knew I wanted my old self back. Took like the smallest bite possible of this cookie, and then I felt like I was normal, or like my normal self, and I'm like, whoa, I get it. And so I very scientifically minded. If it's not written down in science, if I haven't confirmed it at least 5 or 6 places, and not like because your girlfriends told you. I don't do that. It's all scientifically based. If I can't find it in science, I'm not going to tell anybody else because I don't know that it's true. So Viceland is really great, has a lot of really great documentaries on that, got me going. My kids used to go, oh, you want to hear an imitation of yourself, Mom? Guess what I learned about cannabis today? And I'm like, shut up. So the other thing that I did was one of the photographers that we use, she told me her story. And her husband was a grower, and she couldn't keep any food down. She couldn't even keep water down. And he put it in everything that she ate. And she says that if it wasn't for this plant, I would not be alive now. And it just breaks my heart because I love her to pieces. And so another friend of mine that I met on Instagram of all places, her husband's a grower, and I wanted to know from a grower what it was like. I didn't want to hear the propaganda. I wanted to know, you're in this business, you tell me what is what. Drove out there, learned from him what it was like and the stigma that's involved, and he goes, you know what? He goes, the reason why this industry has such a bad reputation is because you go to these conferences where we're supposed to be sharing this healing stuff, and guys are dressed in leopard print suits with, sequin green collars and big green, you know, green and gold bling. He's like, no wonder nobody takes this seriously. They all look like clowns. And so, and another person I met that makes like tinctures, my dad goes, oh, so you sell them at the dispensaries locally? And she goes, no. She goes, all they're concerned about is getting people high. They're not concerned about healing people. She goes, my plant is for healing people. It's not about getting high. And so then I don't sell them to the dispensaries, because that's not what it's meant for. It's meant to heal us. And so with the research that I had done, I took that to my state leader, and I'm like, look, we really need to talk about this subject, because it's a very viable way for us, even though not all of our states it's legal yet, but it is a very viable way for us to get off of this nausea pill that has these side effects. You take this to get over this, and this to get over that. And so, you know, like the doctor said, you might still be on an anti-nausea pill, but you're not on 4 anymore. So the other thing that I use that's really great is a balm. So they put the cannabis oil in a balm, and you apply it to your skin. I have, since with the arthritis, which is helped by working out, but it doesn't always work, you apply it, and this is just me personally speaking, but the pain that you're having goes down like 75 to 80% immediately, as soon as you apply it to your skin. And, where was I going? Brain fart. But you keep it in your purse, it's just a little thing, and if, oh, there it is. I was in Iowa, and I slipped and fell, and I'm a good 230 pounds, and fell on my wrists, and I felt like my wrists were broken. I was dry heaving, I was in so much pain, and my hands are bleeding, and I'm like, what am I gonna do, what am I gonna do? I had that balm in my purse, and I put it on my hands, and all of a sudden the pain was gone. So it was like, there's nothing on the market that anybody sells that is gonna do that for you. So, and oh, what am I gonna get addicted to heat, like a balm that I put on my skin because I have arthritis? Like, no. Like I said, I've never smoked a day in my life. I'm a total control freak. And so I'm not about dropping out, or whatever Timothy Leary says, you know, dropping out and tuning in, or whatever. So like the stigma that people have about sexuality, cannabis has a stigma, and it's a social stigma, and it's spread by lies. It's not truth. So if you have questions about it, ask her, or ask. I can only tell you from my own perspective what I've done. I've never smoked. I've only ever used edibles or used the balm. But Mother Nature made it, and it's perfect for certain situations. And I just can't wait for the whole country to realize that it's a moneymaker on the state side, and it helps heal us in a good way, so that we're on a million different stuff that constipate us and make all kinds of other stuff. Yeah, that's, you know, it's not going to happen. And in some people's cases, you can grow it yourself. So, you know, it's just like growing your own vegetables.
Do you make your own, like, balls and stuff?
No, I purchase. I live in the desert, and I'm not a very green thumb, so my whole yard is cactus.
The balms are there, like, with, like, cocoa butter, right?
They have a different base, so it has to have a carrier.
Yeah.
So coconut oil, shea butter. There are some lubes, Good Clean Love, that gave me some really great samples. They have a lube that has it in it, so perhaps if you had a bit of pain or atrophy, perhaps it would help with that. Some of them do have a smell, and like I said before, the association I had with the smell was that stoner, you know? And now, because I use it and it heals me, I smell it and I go, healing. So it's like an aromatherapy type thing. I had a dog that had a cancerous tumor in his salivary gland. He wasn't eating. so I went into the dispensary and I'm like, I need something that's gonna help him to eat. And so I would put a little bit of it in his food, and sure enough, he would eat. But every once in a while, I have a little nug in the cupboard, and it's I just like pop the lid on the little dank tank. My 15-year-old comes home and tells me all these euphemisms. Sniff it, and it's like aromatherapy. You feel better, and you close the lid on it. I have no desire to smoke. I've had people ask me, and I just don't, it's just not in me to do anything for fun. Well, I do lots of things for fun, but to do it like for any other reason than that there's something wrong with me. Okay, so I think my story is about to end. Do you want to come up and we can do some questions?
Yeah, sure.
All right. I think I saw Jody's hand go up first.
How long does that cannabis oil last when you put it on and it starts to make your joints feel better? Do you use it a couple times a day?
Probably like twice a day. It all just depends on your. The one that I have is like a big chapstick. It's about this big around. This company, I think it's called Honey 420 or something like that. Makes it. If you want to know, I can get it to you later on. But it looks like a big chapstick balm, and so it won't melt in your purse. Because a lot of the other stuff has like a low melt, whatever carrier they use melts really easily. It's a little bit hot, you know, like your lipstick melts in your purse. That ain't cool. And then all your good stuff's gone. But it's in a little balm, and you just apply it like chapstick, and it, you know, goes on. You can travel with it. Like I said, I took it to Iowa with me.
So what I found is that typically when it comes to topicals, pain relief lasts anywhere from about 2 to 4 hours. So you do have to keep on I don't know if this is working. Okay. It typically lasts about 2 to 4 hours, so you do have to keep on reapplying it. Now, the important thing to know is that you can keep on reapplying it because it's very local absorption. You're not absorbing enough of it into your bloodstream to cause any psychological effects.
Tests say that it won't show up in a blood test because it stays within the endocannabinoid and VAX.
Yeah, but
it's
not sure about that.
Enough testing hasn't been done to really tell for sure, so I'm not telling you your P test is going to show up because we haven't really done enough testing on it to really know. In the green.
Okay.
So there's been a lot of talk about the different types of cancer that we all have. For instance, I'm HER2 positive. So there's talk about if the CBD is better than the THC, and like what you're supposed to get for your type of cancer.
Yeah.
I have bone pain like crazy, anxiety attacks, panic attacks, depression meds, like so much that I have to send my kids off to school and take a nap.
Okay.
So I need something that's going to be able to help me live my life normally.
Yeah. So it's really going to depend on the condition itself. So marijuana makes a whole bunch of different chemicals, and when I was talking about cannabinoids, that's what these chemicals are called, cannabinoids. There are two that it makes in high concentrations: THC, which everybody knows about or has heard of, and then there's CBD. Okay. Now the main difference between the two is that THC is a psychoactive compound, and CBD is non-psychoactive, but they both have medical benefits, okay? So let me give you some examples. Appetite stimulation, for instance, that's where the THC helps in my cancer patients. When it comes to anxiety, for example, it's a CBD that helps. So it really depends on the condition itself. When it comes to pain, again, it's going to depend. Like if you have one joint that's arthritic, then in all likelihood you're going to benefit from just a topical. But if you have multiple joints that are arthritic, then you know, using a topical is not going to be of much benefit to you. You really have to use it internally. So it's going to depend, is what I'm going to say. Okay?
In the blue.
Dr. Patel, how do we find a reputable pain management doctor who prescribes medical marijuana in our community, so we don't end up at a shady one?
Yeah.
I had somebody go like, well, my doctor won't prescribe it for me. I'm like, no kidding. You don't go to that kind of doctor. It seems like a really shady operation, insurance referred me to had no pictures on the wall. It was really shady, and I'm kind of like, I don't know about this. And so you'll go into like a place and it's like a double wide or something,
Yes.
and you do like a conference call with a doctor, and he might not even look up from his paper the whole time. You fill out the paper, they fax it to him, and he looks at the paper. He might not even look up at you the whole time. So you have cancer, yes. So you know you have anxiety, yes.
Is your doctor?
Say that again.
Is your doctor in Venice Beach?
No. But so and as far as getting your license, it seems like a really shady operation because of you have like mobile doctors, but your physical doctor might not. Your like primary.
No, I know, your primary won't, that's why I'm
Yeah.
asking if Dr. Phil
Yeah.
has any
Yeah,
wisdom for
so
us.
couple tips. So I actually have created a presentation on this, and you can access it online. So it's just drrachnapatel.com/presentation. But just to give you an overview, right, obviously any doctor you go to, you want a doctor that you can trust. And yes, the industry does have a reputation of like she explained, it's shady. So what you want to look for is, you can always go to the state's medical board's website, you know, check up on the doctor's background there. So that's one important thing. But the other thing is that they should be giving you very specific information, okay? So before you go, ask if they answer the following questions. One, are they going to guide you in terms of what combination of chemicals to use? Number two, are they going to guide you on what the best method of use is? Number three, are they going to guide you on how to figure out the right dose? Dosing varies highly from patient to patient. And a big mistake that a lot of patients and just people in general make is that they use too much, and then they end up getting side effects from it. You're not getting the medical benefits, you're all of a sudden, you know, just getting side effects, which is what we don't want. So that was number three. Number four, are they going to tell you when to use it? And number five, how often to use it? Those are the basics that you should be getting. And in addition, they should be guiding you on side effects, what the side effects are, how to avoid the side effects, and what to do in case you do get side effects. So before you go to any medical marijuana doctor, this is the information that you should be getting from them. Hopefully those are good guidelines. But I do know it's a growing field, and I know that there aren't, unfortunately, there aren't too many doctors around that are doing this.
Or that
So
will give you that much information.
yeah, so hopefully that helps.
In the back, in the black.
So is it okay if I just share my experience? I'm stage 4. I'm stage 4, and I've been using medical marijuana throughout, and I kind of had to teach myself because a lot of these doctors, like you said, are shady. Just go in and get the card from them. You kind of just walk into their shady ass office and tell them I have cancer, and they go, here's your card. And I've been doing that for about 2-3 years. My experience is with, I have lung mets, so initially I had started with a vaporizer because I didn't want to smoke. Obviously, lung mets, not a good idea. I started out with a vaporizer, and with a vaporizer it's easier to titrate your dose, like Dr. Patel said. It's easier for you to measure how much helps you. So if you use a vaporizer, that way you can say like, okay, 1 puff, and it kind of hits you a little bit more quickly, and you can say, okay, that's good for right now. I haven't had radical alleviation the way that Stori, I think is your name. I haven't had radical pain alleviation that way, and I haven't had anything magical about it, so I don't want people to get like,
Right, because it varies
it's
from
not
person to
magical,
person.
right?
Yeah.
Yeah.
But I take it every night. I take a pill because the pill seems to be, I don't have as many side effects. My mother's house doesn't smell like weed.
Right.
I keep it in the freezer because I can't stand the smell. It smells like, the burps are rough. I'm sorry, Mom. The burps are pretty rough, but it helps me to sleep. It helps me kind of get out of my own head. You know, like when you're trying to fall asleep and you start thinking about all of the thoughts in your head. Also, I wanted to mention, I'm sorry I came in late, but the difference between sativa and indica,
Yeah.
I've personally
there is a difference. And so
Yeah,
personally,
big difference.
I have a little bit more relief in terms of anxiety and that kind of thing with the indica than with the sativa. The sativa doesn't work as well for me. It makes me a little bit more anxious and hyper and everything. The indica seems to calm. It did help with nausea, and especially with like, what is all that? Yeah, I took like handfuls of nausea pills. So it does help a little bit with nausea, and it's kind of nice to be able to take something that doesn't knock you out all day. And you can just take a little bit, see if that helps, then you can take some more. And it's one of those things, it's not like the opiates where, you know, you take one and you're like, okay, well I haven't pooped in 4 days.
Right,
So,
right.
with the marijuana, that's a little bit easier on your system too. So I just wanted to share. And also, if any of you want to know anything, I will absolutely share my experience with you.
Thank
And
you.
if you want any help, absolutely contact me because it's been wonderful. It helps me sleep. I'm not an idiot when I wake up in the morning. I go to work, I ride my bike, I can do anything. It's been really wonderful, but I just don't want to set the expectation that it's going to be a magic drug for
Yeah,
everyone.
totally.
Yeah.
Or
And
cure you, that whole thing it's not going to do, but it's
Yeah.
definitely been very, very helpful for me.
So I just want to comment on these terms, indica and sativa, that you mentioned. So here's what I found. They're agriculturally very relevant to distinguish plants, but when it comes to medical use, in states that have legalized medical marijuana, they test laboratory test products, okay? So you can get exact amounts of the different chemicals that are in the products that you're using. That's what you should be paying attention to. Indica and sativa are very vague, very general terms. Now, as cancer patients, the other important thing that you should be paying attention to when it comes to laboratory testing is, has the product been tested for fungus and bacteria, okay? You don't want to get sick from it, especially if you're on chemo agents that are suppressing your immune system. The industry is in its infancy, okay? So we are making progress, but a lot of states don't have these sort of standards in place. A lot of this is being done voluntarily. So you know, be proactive and make sure you ask this question. Marijuana is one of those plants that's very prone to growing mold, okay? And it's not that you just can't see it. Sometimes there are spores there, and a lot of times, if you've heard of aspergillus, yeah, that's a common fungus that's found in marijuana, and that can infect your lungs if you have a compromised immune system. Bacterial infections from marijuana are less common, but still possible depending on if it's handled properly or not. So just something very important to watch out for. Go ahead.
Hi, I'm from Florida. We just finally got this marijuana on the ballot.
Yeah.
I use it for metastatic lung, liver, colon, and what else? Leukemia.
Yeah.
It goes on. I have a lot of pain. I'm on 100 milligram patch and 30 milligram extended release morphine every 4 hours. 4 milligram, 2 pill of Dilaudid. Constipation, I have to take the shot every other day so I can go. Lenses, all of it. On top of it, I have MS, Divix disease.
Yes.
It's the mileage deterioration. So, we haven't had the opportunity to test marijuana. I am in law enforcement. I can't do anything illegal.
Yeah.
And it's a big deal for me. That's my work. That's my life.
Yeah.
I have a PhD on that. So, I do have aspergillus. I don't know how it came to be, but it caused pneumonia over and over and over again. So, do you think, should I, now I can get a doctor, perhaps in Miami, to help out? What other things I need to ask, especially for me with MS, cancer, and aspergillus? That'd be a good fit for me.
Yeah. So.
Sorry, I'm not contagious.
Yeah, no worries. Yeah, so, okay, so those are very specific questions that you're asking me. I'm gonna generalize it so that the whole audience can benefit from it. But like I mentioned before, those 5 questions that you should, or 6 questions really you should be asking, which is, you know, what combination of chemicals to use, what's the best method to use, and then how much to use, how often to use it, and side effects, okay? And then again, making sure that whatever you use has been tested for fungus and bacteria. Now, Florida has just recently passed medical marijuana, so it may, so it may be a bit until they actually implement everything, all the new laws, all the new laws and regulations, okay? But a good resource to go to get information on the medical marijuana program in your state is that every state has a website dedicated to its medical marijuana program, and that's where you can get further information. And they may have information on, you know, things like laboratory testing, what's required for a product to make it to the shelves, how if products get recalled, why are they getting recalled, all of that. Obviously, Colorado is far more advanced than a lot of the other states, but a lot of states do have good information on their websites.
Okay. We have about 10 minutes left, so is there someone that hasn't asked a question?
The one in the green right here, the Chicago shirt, has had her.
Okay. Chicago, okay,
Yeah, we're pretty new to medical marijuana, and it doesn't seem like dispensaries are popping up everywhere and there's not a lot of information. My oncologist personally says, I'm not against it, but I don't have the authority to write it for you.
Yeah.
So I'm just confused because I want to take advantage, but in the same sense, I don't want to get it from my friend who I haven't talked to in 10 years.
Right, and you have to do so much like real research on your own because it is such a baby. Like,
it's so small.
Yeah, you have to do so much research on your own, and everyone, I can't emphasize this enough, everyone is an individual operating system. I might be this big thing, but I can only take like a tiny little bit, and you know right away that you've taken too much. So each product, you have to try and give yourself, like I give myself, 8 hours. So I know that in 8 hours I don't have to do anything. So in case this one leaks over a little bit longer, I can still function and take the kids to school. So each thing, you have to make sure that you know what works for you.
Yes.
And then get that one repeatedly because you know how much it works. I mean, as much as all the different things look fun to eat and stuff, whatever, I mean, but what's important is that you get what works for your malady.
Okay.
And you and her and her and her and her and her, they, everyone, it could be your sister, and you have completely different tolerances. So you have to, it's not like, you know, take X amount of this drug for every X hours. It's not like that. You have to figure out what works for you, and that's what's hard for us is that we have to do so much work on our own for it. And everyone works with it differently. Like pain medication doesn't work for me. I use it
on the fentanyl patch, so
I use it 3 times and then it doesn't work anymore. It just makes me pissy. So, you know.
And then what's the legality of, like, obviously there's tons of dispensaries around here, but I'm flying back to Chicago.
You can't because you don't have a license.
So,
Got it, okay.
So let me comment on this. When it comes to doctors specifically, they fall into 1 of 3 categories. Okay, the first is that, you know, some doctors will just straight up judge you for even bringing up the topic. And I think a lot of that is they'll say it's because, oh, there's not enough information or research, but I think it's because they haven't taken the time to look into it. Because I've spent years doing this now, and in terms of information, yes, it's preliminary research, but it still helps to guide us. I mean, we do also use prescription medications off-label, for which there isn't a lot of research. So you know, it's about equivalent. The other thing is that then there are patients or doctors that are, you know, kind of neutral. That, you know, you can what you do on your own time is none of my business. And then there are the doctors that really are okay with you using medical marijuana, but they work for a system that won't allow them to write a recommendation. And this is important to know. It's because they maybe get, the system that they work for gets federal funding, right? Medicare reimbursement, Medicaid reimbursement, and that is in direct conflict with the drug enforcement agency's schedule, where marijuana is a class 1 substance, okay? So usually it's independent practitioners like me that can take the risk of issuing a recommendation, okay? So like I said, the state's websites also typically list doctors that you can go to that have signed up for the medical marijuana program in that particular state, okay? So you can always look to, those websites are very informative.
Okay.
So you can turn to those.
Question over here. A couple more, I think we have time.
Good morning. Thank you everybody for sharing. On a path of trying to, I guess they call it self-medicate, and I'm in Florida as well, so I'm kind of limited in trying to figure out what works for me, working with the issues of the neuropathy and sleep and trying to wean off of the Ambien that's kind of controlled my life for so long. And we mentioned indica sativa. So I don't know if you can ballpark, would you make a recommendation? I'm feeling I want to try your ointment that you talk of topically for the lymphedema, but I'm working on the weaning off of the meds, and I think indica comes to mind, and I've been doing the oil and the edibles.
It's going to depend on the type of pain. So fibromyalgia I treat differently than arthritis, than nerve-related pain. Okay, so it's really gonna depend on what the condition is.
And
so
just because one of them is a downer and one of them is like maybe is a little bit of an upper, doesn't mean that's what your body's going to do with it.
But when I think if you need to go to sleep, you're not going to take a sativa to go to sleep. You would do an indica.
Well,
It depends on how your body works.
In cases of mild to moderate pain, those I treat differently than cases of moderate to severe pain. There are nuances to the medication. I think there's a lot of overgeneralizations being made that, oh, indica's going to treat this, and sativa's going to treat this. Like I said before, it's really the specific combination of chemicals that you really need to look at. And different nuances, like certain methods will work better for certain conditions than others as well.
Like a tincture or an edible.
So it's nuanced. So it's gonna depend.
Thank you.
Yeah.
We'll have one back there, a purple one back there.
Yeah, then this lady, then that lady, and then we might have to wrap up.
I'm from New York, and I think we have passed it, so the doctors are starting to be able to give out the licenses.
Yeah.
If I obtain a license to be able to have medical marijuana and my company gives a drug test,
Yeah.
are they allowed to have any repercussions? Thank you, chemo brain. Repercussions towards me.
So great question. And I actually have, if you go to my YouTube channel, I just interviewed an attorney on this. So you'll find that informative. It's about a half-hour interview. But just to give you an overview, it's going to depend on the state that you live in. Some states do have protections in place for those that are using marijuana medically, okay? Where it's what is it called? The burden of proof is on the employer that it is actually impacting their performance at work.
Okay.
I think New York might be one of those states.
Okay.
There aren't that many. Again, look on that website on your that your state has. Okay, so some states do have protections. Some states don't. Okay, and also it also depends on what the rules and regulations are when that are already in place when it comes to drug testing and drug use in the workplace. The attorney that I spoke to, and she mentions this in the interview, I know Oregon, for instance, she said that you need to have a good reason to drug test. You have to have a reason in that specific state. So it's going to vary state by state. Okay?
Thank you.
Oh, of course, yeah. That's sort of clear cut with federal. But if it's non-federal, if you're a non-federal employee.
Well, some companies have contracts with federal agencies.
Right.
Yep.
And if the federal government is in contract with working under, you will be subject to drug
Again,
testing.
it's like an individual thing that you, with the company that you work for, you have to figure out what's.
Yeah.
My husband has a Class A driver's license, and he can't, because they test them more, they test someone with a Class A driver's license that drives a big rig more than they would test you or I, because you're driving this, you know, huge machine. So if he goes and does a drug test, I mean, he had microscopic amounts of something in his urine, and they pulled it, so.
Yes, we have a question here. I guess more for you. How do you feel about, I'm stage 4 and I've been dosing for 3 years now. And the only time I've taken a break and couldn't get my hands on, we live in North Dakota, it's not legal, obviously, so, but who cares when you're stage 4 and got a 5-year-old and a 7-year-old or whatever. So, I guess my question is, the only time that I stopped dosing, I had a PET scan and there was progression. So how do you feel about, like, because I mean, I work close with a guy in Colorado, and like he does all my, I guess I make this suppositories, I do most of it anally. I put it on my butt. I don't put it up your butt too far, or you're gonna get in there. Just because I don't like.
Thank you for not being afraid.
I don't like
love
smoking it.
insurance.
I don't like feeling messed up all the time.
Yeah.
I've been messed up. But I like, how do you feel about like CBD treating cancer?
Okay. So this is an important topic, one that I feel strongly about. So at this point in time, when it comes to the research has only been done in cell cultures, so in petri dishes and in test tubes, and in animal models. Okay, this research does show that marijuana does have the potential to it has anti-cancer properties. However, in humans, we don't have enough information. So as a physician, I would not make the claim that it cures cancer. I know there on the internet, there's all sorts of claims being made that marijuana cures cancer. They're unqualified claims, okay? Now, clinically, have I, seen marijuana cure any of my cancer patients' cancer?
Like you can keep like state, like
No.
obviously it's not going to cure.
No, I wouldn't even say that. No, I wouldn't make that claim. We just know at this point that it has anti-cancer properties, but when it comes to even keeping it stable or curing it, I wouldn't make any sort of claims at this point, okay? And where patients may be hurting themselves is if conventional treatment has shown that yes, this chemo or this radiation has a good chance of treating your cancer, and yet despite that, you still turn to medical marijuana, I think you're doing yourself a huge disservice, okay? That you're putting all your eggs in this one basket where there's a big question mark whether it even...
I still do what they
Yeah,
want me to do.
yeah, so that, and again, on my YouTube channel, I've interviewed, I don't know if you've heard of Dr. Donald Abrams, but he is an integrative oncologist based at UCSF, and we have a conversation about this, and he feels very much the same way. So take a look at that as well, okay?
So my question is, I know you want it to be individualized, and we're asking what sativa indica, what to do, how to do it. Am I going to that doctor that gave me the card with those questions, or am I going to the dispensary who has the edibles and the weed to get, who do I ask those questions to?
Okay, so typically the people behind the counter at the dispensaries, they're going to be speaking more from a place of personal experience rather than knowledge and medical knowledge and clinical experience, okay? So I would say the best person to go to is your physician who's actually giving you your card. They should have
to
this.
Sell it, so how can they know what the dispensary has?
Just by knowing, having the medical knowledge. So how do I know what I know? I do the reading. I know what the half-life of marijuana is. How it gets processed in the body through the liver, through the kidneys. Knowing all of that, you know how it'll act in the human body. Okay, so really that's the information that a physician is using, and the experience of having treating patients with other medications. It helps you gauge how to use this particular medication as well in a patient who has this particular medical condition. Like, let me give you an example. A patient who's had gastric bypass, they're not going to process an edible like someone else who's had a gastric bypass. So person at a dispensary may not know this. Okay, so that's the type of information that you need to have to safely use medical marijuana.
I think last question, I think.
for a primary care doctor in Berkeley who's been recommending cannabis for 20 years. And kind of on what you were just starting to get into, especially for cancer.
Yeah.
We have patients from all over the country and even from other countries who are using the legal hemp oil. And I just think it's really important in the cancer context to mention that the legal hemp oil is completely different from a cannabis oil. So could you share a little bit more about that?
Yeah, we sell it at our health food store.
Yeah,
You
so-
don't have to have any kind of license or anything, but it's not the
It's
same
very
animal.
dangerous.
So hemp oil is not legal anymore. December 2016, I believe it was the Drug Enforcement Agency, they deemed CBD a class 1 substance. So anybody who's been finding, CBD oil, CBD capsules, whatever, you're not going to find them anymore because it's been deemed a class 1 substance. We sort
Or
of
they're sending it illegally and telling the patients that it's legal and that it's the
Yes.
ricin oil. and
Yes,
it's totally
exactly.
different
Yeah,
product.
yeah, and that's where laboratory testing becomes important. Before you buy anything, you want to say, okay, where was this tested? You can actually see laboratory test results. We'll give you actually, on their website, or you can always, once they give you the lab at which it was tested, you can always go back to the lab and be like, hey, I just want to make sure that this product was tested at your lab, and if these results are accurate, okay? Does that answer your question? Is that what your
Yeah, I just
question
wanted
was?
to distinguish between the
Yes.
legal hemp oil
Yeah.
and the medical
Yeah.
cannabis oil.
And I
They're
think
completely different.
the DEA specifically in December 2016 decided to make CBD a class 1 substance because it was being sold all over the
We
internet.
have over 100 patients who are kids who their parents are buying the CBD
Yeah.
oil online.
Yeah.
It's in every state in the country, and
Yeah.
it's got pesticides.
Yes.
It's not having any medicinal effect.
Yes.
It's not cannabis.
Yep.
It's
Some of the vape stuff that you can do is still available.
I'm still not clear, did you say that hemp oil is illegal now?
Yeah. So let's distinguish between hemp and marijuana, okay? Basically, it's essentially the same plant, but the difference is that hemp, from a legal standpoint, has less than 0.3% THC in it, okay? So it just has a whole heck of a lot more CBD than THC. That's essentially what it is, okay? And so these products that are being made from hemp, they happen to have high amounts of CBD in them, okay? And up until prior to December of 2016, it was being sold, like you said, everywhere on the internet, all over the place, pretty much an unregulated product. And since December of 2000, you're going to see it less and less. You may find, a few kind of stragglers here and there that have managed to get away with it, but you're going to see it found less and less being sold because the DEA has deemed now even CBD a class 1 substance.
All right, thank you. Can you guys join me in thanking these two for their time?